Nous avons maintenant une session spéciale sur les inégalités.
And we have a session on the inequalities created by the health crisis, and especially the inequalities among the elderly. And we wanted to have two experts in this matter. Julien DAMON, first, a professor at Sciences Po Paris, and for the École Nationale of Social Security. He is an expert of poverty and social protection. And we have, after him, Jean-Pierre MICHEL, a well-known gerontologist working at the WHO and coordinating the works on the aging of the world and in Europe. And he's going to talk about this issue as well. So the floor is to Julien. Hello. Yes, good afternoon. I was offered to talk within the framework of this webinar or digital event or a symposium, I do not know which terminology I should use, on COVID and inequalities. And I will share with you for 10 minutes some remarks and observations on this topic without any graphs or figures, just a few general remarks. For the sake of discussion, some remarks may seem quite obvious to the experts, others might seem too provocative, we'll see, and then I will draw a general conclusion. And before the general conclusion, of course, the argumentation. We have heard a lot of a new world, the world after the health crisis, the end of the boom of inequalities, which we encountered during the COVID-19 and the lockdown. There is no novelty in the inequalities, and some inequalities I have written here on the slides. Some inequalities have, on the contrary, increased or even have been exacerbated. This very specific year, 2020, would have not seen new inequalities, but it has been an exacerbation of inequalities already identified. Let me start with the inequalities of residence and accommodation, or from a health and social point of view, the place we live in, where we've been locked down, it's almost like a house arrest somehow. We've been locked down, and the place we live makes a huge difference. The French elite tend to live in flats in Paris, but most French people live in a house they own. And there's a strong inequality between the place you may have been confined, and for the less privileged places with not a lot of square meters, people you had to manage, and your work you had to do from home in a feeling of confinement. So for many people, it's been difficult, but for other people, it was possible to enjoy family in a nice place. I'm not saying that there were the happy and the unhappy, but the period was experienced in a very unequal way. Those who were confined in places too populated, and those who were confined in even pleasant conditions. This is for the social point of view. Now, inequalities in the COVID were highlighted, and there's a difference between the dense area and the non-dense areas. So there's an inequality as to the place you live. There was a small urban exodus, so the demetropolization, which have been identified because desired by the people. It's not been a wave, it's not been a tsunami, but however, it's a movement of transformation of our land planning, and the major cities will lose some inhabitants, and the average size towns will grow. That's the experience we can draw from that. Second point, the possibility to work from home, télétravaillabilité in French, it is a neologism, the possibility to work from home, but according to your expertise and your job. Sometimes it's not possible to work from home. Well, there's nothing new in what I'm saying, but it's been very easy to observe during this lockdown in March and in the autumn. Some people can fortunately work from home, others can work from home, but under complicated conditions because we are not equipped and organized the same way, and others could no longer work because their activities could not allow them to do that. And some part of the population were not able to work from home. They had to go to the office, unfortunately, to make sure that everyone could receive electricity, water at home and at the hospital. So there are inequalities from residence accommodation point of view. When you have the possibility to get out of your home for 1 hour a day or no, 3 hours a day, you see people homeless. Those having no home cannot be locked down. And the government has made huge efforts, and the associations as well, to increase the number of places for the homeless. Over 50,000 accommodation places, now 300,000 accommodation places to house homeless people created for the period. However, there are still some people in the street. We see the social inequalities exacerbated by the crisis. And there is another inequality, nothing new here, the destiny inequalities. Everyone would understand, of course, the Zoom education terminology. You have young kids from the primary school right up to the secondary school, and they are more or less equipped because some of them do not have access to a quality connection. They have the possibility or not to be helped by their parents. And in the long term, the crisis we went through will have an impact because there has been a degradation in the building up of the human capital. And there's something else we have observed. The students do suffer as well from these inequalities and the consequences of the lockdown. The courses, the virtual classes are not as qualitative as if you are with your teacher face to face, whether it's a Team, WebEx or Zoom, never mind. It is difficult and it highlights the inequalities. It's a major inequality as well. And this health crisis of the COVID-19 is well, it's a health crisis. We should never forget that. Beginning of March in France and beginning of January for the international alerts, well, we didn't know that who was going to be struck and hit. What turned out to be is that the elderly were the first victims of the coronavirus. It came late. We learned that in April or May, most deaths were elderly people. And when we deal with the inequalities of the COVID-19, this first observation, COVID is not equal in its mortality. We should say la COVID, feminine. Okay, so the health crisis provokes death among the elderly mainly, and that's the first inequality, of course. And what about the young people? Let me talk about the young people. The economic inequalities. You have to have in mind that the financial crisis we experienced with the degradation of some assets, especially real estate assets, has a first macroeconomic consequence. It reduces the wealth of the most wealthy people. So over the period, you have been a reduction in the economic inequalities, but from the top, because the wealthiers have seen their assets reduced over the period of time. Is it going to last? Probably not, because the financial market is picking up again. And so there has been, however, a reduction in inequalities from the top. There is an inequality from a generational point of view. The economic victims of the crisis are the young people, and the victims of a health crisis, that's the elderly. So we should show up solidarity. Lockdown is a collective gesture of solidarity for everyone, and mainly for the elderly. But this has a consequence on the social accounts, with huge deficits, of course, abyssal deficits. In France, they were at a level such that the experts tend to talk of uncertainties, to use a diplomatic language, and beyond the uncertainties, pending questions, pending issues. It means that we do not know where we're heading to in terms of social accounts. So inequalities are quite conventional and exacerbated. The class struggles, a conventional one, whether it has to do with location of jobs, and the class struggles in terms of income and location, house or a flat, a large city or a middle-sized city, a suburban environment, rather pleasant. And what about the age struggle? People tend to love each other quite a lot. They keep meeting virtually and so on and so forth. But in the social accounting system, for the years to come, we have really to insist upon the solidarity among generations. And I will summarize all this with a formula for 2021, because that's where we'll see poverty and inequality. 2020 is a year of crisis and contingencies, with social expenses, very high expenses to dampen the consequence of the crisis. But in 2021, the inequalities will be unveiled, and will be deconfined inequalities. So this is it within the time allotted to me. Thank you, Julien, for these comments. Julien is at this social security school and is a teacher at Sciences Po and an expert in inequalities. We are going to give the floor to Jean-Pierre Michel. Jean-Pierre Michel is a member of the Academy and is a well-known gerontologist of the WHO. And he wanted to come back to this topic of inequalities among the elderly due to the health crisis. Jean-Pierre. Good afternoon to you all. My name is Jean-Pierre Michel from the Geneva University. I'm pleased to be with you to talk about the observation of the quite societal inequalities among the elderly. COVID highlighted the reality of an aging France. For the time being, in France, out of 100 people, 20 are over 65 years of age and 6 over 80. This aging of the population is going to carry on, and by 2050, we'll see that 26 people out of 100 will be over 65 and 11 over 80. It is important to note that for the time being, 10.5% of people are over 65 and less than 74, 6% between 75 and 84, and 3% over 85. And as you see here on this curve, the over 85 and over 75 will increase dramatically, whereas the over 65 will remain stable till 2070. There is also an inequality of aging, but according to genders. If when you are 50 or 55, you have about the same number of men and women, there will be more women as you get along with age. And when you're quite old, there are more women than men. This feminization of the old the aging is differential in France, and this survey out of 36,000 French districts and cities in France shows that if some regions are quite young, like in the Parisian region, we see that the center of France accounts includes about 40% of over 65 years of age. And this is a major concern among the people in charge because there is a disappearance of rural commune. And this is due to the fact that a lot of old people live on their own at home. And we see here in this survey, the Petits Frères des Pauvres, that 40% of over 60 would live on their own at home, would have a basic professional activity. They would live in a block of flats. 40% would not use the internet and would live with less than 1,000 euros each year. And so this is raising a lot of problems, of course. This is undeniable. Those inequalities are major ones. The wealth of households is rather low, 83,000 euros on average, with 10% of rich people, but 10% of very poor people as well, with a very low limited budget. And from a wealth point of view, the French average is 220,000 euros. And once again, you have the wealthy people with real estate assets and 10% of poor who unfortunately do not have anything or almost nothing, raising huge problems. So if we insist on the concept of poverty, you have to know that when you are over 65 and 75, they are not the poorest in France. If the French mean or average of poverty corresponds, well, the definition of the poverty is 60% of the average level, but for France, this rate is 8.1%, whereas for over 65 years of age, it's 7.5%. However, when we talk of aging, we have to include those economic concepts within the concept of aging, corresponding to those concept of reduction of physiological reserves. And in that case, there is fragility. People become fragile because of a reduction in the capacity of the organism to respond to pressure and chronic diseases. And when there's an infection like the COVID-19, we see very well that there's an aggravation of those pathologies. And in that case, people become vulnerable when they accumulate a health problem and an economic problem. And the personal, social, economic context defines the concept of vulnerability. And this intervenes in the results of the caring process. If you take people at home, we see that the old people suffer from a lot of chronic diseases. 2/3 of over 65 years of age. And we see very well that those chronic diseases will be accumulated over time. It's a multimorbidity. As you see on the map, when you are 80 or 85 years of age, you may have up to 7 diseases. The most frequent ones are arthritis, nervous breakdown, cancer, osteoporosis, diabetes, and the other pathologies like respiratory disease, cardiovascular, and neurodegenerative diseases. So those people suffering from those pathologies also have a restriction on a daily life basis. And the older you are, the more restrictions you have. Over 40% of the over 84 years of age living at home have restrictions in their daily life for the daily activities. This dependency is a major problem in France. In 2017, the number of people benefiting from the benefit for handicapped people in France was 1.5 million, whereas the total cost for these expenses to finance this allocation or benefit amounted to 11.3 billion euros. And in the near future, there will be a huge increase. And by 2050, there will be 4 million dependent people. Those people would be at home when they're young and would be living in an institution when they are old. And in these institutions, the number of people increases with age. There are more old women in the institutions due to their age and due to their inability to cope with daily life. Men are, this is more seldom, and it is not as frequent. In all cases, however, we see that people living in retirement homes have a very severe functional disability, whether you are between 65 and 85. We see that the people living in retirement homes 60% have 60% of incapacity in their daily life and often losses of autonomy. This accounts for following fact. Some regions are suffering from this dependency, especially in the center of France, and there's an inequality in terms of breakdown, the distribution of the so-called EHPAD retirement homes. This is a home to accommodate dependent old people. There are 11,000 such establishments. 42% of them are public establishments, 800,000 beds, 97% are occupied by people with an average age of 85 years of age. And the yearly cost of those long-term care amounts to about 11 billion. And we should not forget that families still have to pay a remaining amount, a balance, which is not negligible. What is the role of those retirement homes? The role has changed. In the past, it was a space to live. Now it's a place where you receive care. Is it compatible to have both? Well, what seems obvious and which came out very strongly during the pandemic is that the caring staff was lacking and there should be a turnover. So is it a place to live, to receive care and to die? Well, we see that you die usually in hospitals. It is you die seldom at home, and more for the very old people. You have also the retirement homes, and this they tend to die more and more there in those homes. So we forget that death is unique. Each death depends on the life context and the death context of the person. It also depends on the right of living and the right of dying, the moral rights and the legal rights, without forgetting, of course, the problem of spirituality characterizing each of us. So under such conditions and in front of those reality of an aging France, COVID has highlighted major inequalities. And those inequalities are mainly social inequalities. Social inequality is from an unequal distribution of resources of the society between their members. This unequal distribution is due to the structure of the society, and there's a feeling, therefore, legitimate or not, of injustice within the members. So this COVID crisis highlighted 4 types of inequalities: health inequality, inequalities in terms of rights, resources, and stereotypes, the stereotypes of the society. If we talk about the health inequalities, if you look at the report of SOS Médecins during
care has been given by doctors on call, has been given to young adults and middle-aged people. But when you look at mortality according to age, middle-aged adults have a relatively low mortality rate, but the mortality rate of the senior citizens was extremely high. So we can see that next to this inequality faced with death, there are other problems of inequality. There are very few policies, prevention policies, and this is something that is shared by all the European countries. Elderly people were more frightened than others of falling ill, and the fact that they didn't know there was any treatment or any care, which was a cause of great concern. And when they were tested, they were afraid of being isolated, and this therefore increased their worries, their concerns. And then they heard news concerning the cleavage between private and public sector. They heard terrible things concerning limits to access to information, and we'll come back to this question of information, but also limits to medical services or healthcare, and then using age as a criteria for choosing whether, or deciding whether people could benefit from care, with a triage of cases depending on age, was something that was very, very badly perceived by elderly people. On top of these inequalities, there are other inequalities which are social inequalities. And of course, as I showed, there were huge environmental inequalities, and people who had found it very difficult to apply barrier gestures and social distancing, and they were shocked by the dematerialization of many services and the fact that information that was communicated by radio and television was extremely contradictory. And lastly, they were informed that there was not enough carers in hospitals, that they were overburdened with the number of people in hospital. So this was another cause for concern. And what they suffered of at home was being lonely and being isolated. And if they were in long care retirement homes, there was this problem of being isolated within these homes. So isolation and loneliness were the things they suffered most of. And in retirement homes, the fact of restricting contacts was something that was very badly experienced by families and elderly people. And families were very often prevented from being able to say goodbye to their loved ones as they were dying. This has been catastrophic. So next to these negative aspects, one should also concerned retirement. In France, there is a long life expectancy in retirement, and also people going into retirement earlier. And some people said, yes, these elderly people benefit from their retirement, forgetting that these retirement pensions were therefore just retribution for many years of contributions. And in the press, there's a lot of talk about the cost of care. And if we analyze the cost of care for the elderly population in France, which is extremely high, is essentially linked to the fact that the French are fortunate that they live longer, and 80% of these costs are linked to care, the cost of care, the last part of their lives. And the COVID pandemic has increased the cost of care. So these notions that may seem somewhat out of context, but these there have been problems between generations concerning funding of retirement, concerning the cost of care, but also the fact that whole of the population was impacted by the crisis, and those inequalities that were pre-existent, and there were social security services that were not covered by the current coverage, and there were lots of services that had to be paid out of pocket, and that meant that when you look at the stigma concerning or linked to age, we have to think first of all about ageism and pay attention to this. That's something that I try to describe in economics terms, is the association of stereotypes of preconceived ideas concerning age. It is a feeling that the young population feels towards the elder population, and this is clearly illustrated by an expression that has been used widely, that elderly people are termed as okay boomers, and this is used as a derogatory term, and it may also be an answer to another concept, which is adultism, which is the power that the young generations have over the older generations have over the younger generations. So there's a sort of gap between the different age groups is an important factor to take into account, because next to the stigma associated with age, you mustn't forget there are other stigma that are of a racial and ethnic nature, of an economic nature, and there is another phenomenon that emerged during this COVID crisis, the fact that the population on the whole is computer illiterate, and that most elderly people, a great majority of elderly people, don't know how to use the internet. So this digital divide, major digital divide, appeared between the young generations who use these communication tools and the older generation, which was incapable of using these new technologies. And this is clearly illustrated by the major progress that's been made in terms of technologies that pose a problem of dehumanization of society for the very elderly. So with such aspects that that are clearly apparent, and these inequalities that have come to light in the recent months, we have to think about the elderly of tomorrow. Well, we have to think about what the young people today think and how they behave. And we see that more and more in articles and books published, it seems that young 20-year-olds are a society that is much more horizontal and is less able to think about the elderly. And that is why it is important to think about more and more is to try and take advantage of this crisis to try and reset society, as Klaus Schwab suggests. I would like to thank you for your attention, show you a picture of a thank you expressed towards the health carers at the gate of a hospital. I am available for your questions now. Thank you.